Today, we're going to talk about the chest pain guide that every single adult needs to know. Chest pain is one of the most common reasons people go to the emergency room. Chest pain is one of the most common reasons people come to see us. Chest pain is a very common reason people get freaked out and get nervous about what's going on with the heart. So, so today, Dr. Lacey and I just want to take some time to give you an overview about what chest pain is, when to seek help, and when to get reassurance.
Today on Living Heart Smart, we're going to talk about common causes of chest pain, and we'll break them down into causes of chest pain that are life-threatening and also causes of chest pain that are not life-threatening.
Importantly for us, this is our verbal waiver that we are not your doctors, and that please, if you're having chest pain, get help. Even if we are your doctors in real life, this isn't the
This
place
doesn't
to
count.
get. No, this doesn't count
No.
anymore. So go get help if you need it. But this is a great topic. I'm so excited to talk about chest pain.
Okay.
Carolyn, I really want to start this off with what I would call red flag symptoms. So if you listen to nothing else, make sure you listen for the next minute or so. So if you're having chest pain that you feel is a pressure, tightness, heaviness, or like an elephant on your chest, or if you feel a tearing sensation or ripping, and you may have some other symptoms with it, like shortness of breath, sweating, this feeling of impending doom. These are critical symptoms that you need to get checked out for immediately. You need to call 911. So let's start with that. Those are the kind of symptoms typically we hear when someone is having a heart attack: pressure, tightness, heaviness. And sometimes the pain will radiate, sometimes it won't. You may feel some extreme fatigue, especially women don't have all the classic symptoms, or the people who are elderly. So just be aware these symptoms aren't going to go away. If they've lasted more than 5 minutes or so, get help.
Right, Matt. And I think that you said it helps to reiterate it. Don't
Yeah.
drive yourself to the emergency room. If you think something really bad is happening, you need to call 911.
Yeah.
This is what they do.
They
This is
say
what they
time
do
is
for a living.
muscle and every minute counts. So get
Right.
to the hospital, we'll take good care of you. Everything's going to be fine. Just get help. So get that out of the way.
Yep.
And then now we're going to back up a little bit and talk more about the different causes and what you should be thinking about and documenting when you start having chest pain to help your doctor when you finally see them.
When you do see a doctor who you're talking to about your chest pain, you're going to get asked a number of questions. They all kind of follow a theme. So, what does your discomfort feel like? Is it pain? Is it pressure? They're going to ask you, where is it located? Where in your chest? Does it move anywhere in your chest?
Yeah.
They're going to want to know, how long does it last? Just seconds or hours or minutes? When you have the discomfort, is there anything that you know that can trigger it? If you go for a walk, does that make it worse? Is it after a heavy meal? What have you identified makes it, what can bring on that chest discomfort? And on the flip side, what makes it better? If you know what makes it worse, what have you figured out makes it better? And then finally, what other symptoms are going on at the same time? Are you having shortness of breath, palpitations, a lot of nausea, or severe fatigue? These are all very common questions that we're asking patients when we see them about their chest discomfort.
Yeah. And I think when a patient having symptoms like this can help quantify a little bit more than just saying I'm having pain, that's really going to help the doctor. And then from a doctor's standpoint, we're going to take that information and it's going to churn through our head so we can dial in on a diagnosis. But then we're also going to take in, your age, your risk factors, your prior history. And once we do all that, we're going to be in great shape to help figure out what your chest pain is and how to treat it. Okay, Carolyn, let's move into what I would call the 5 most dangerous causes of chest pain, if you will. The things that are on the top of our list when someone mentions chest pain, we're either ruling them in or ruling them out, because the rest of the causes we can sort of deal with later. These are sort of 911 emergencies. Number 1, of course, as cardiologists will say, is an acute myocardial infarction or heart attack. So what does that feel like? That is the sudden onset of a chest pressure, heaviness, tightness in the chest. People often tell me it feel like their chest is getting squeezed or an elephant sitting on their chest. The symptoms of chest pressure, tightness, or pain can often radiate to the jaw, to the shoulder, to the back. It doesn't have to, but it does commonly. Very fatigued feeling is what many people tell us. You can't really move at all because any exertion makes the symptom worse. Many people feel some nausea. Oftentimes you feel a little diaphoretic or sweaty. It's a very uncomfortable feeling and it's not going away. That is a heart attack until proven otherwise,
Right.
and a 911 call.
And its cousin on the flip side of that is what we call unstable angina. You don't have to worry about those two different terms. Still the same problem. There's an artery that's blocking. And so sometimes people tell me, in addition to all those symptoms that Matt just explained, sometimes people tell me sort of a stuttering buildup of their symptoms. It started and it wasn't too bad, but then it kept getting worse. That's what
Yes.
we would call unstable angina.
That's right. Saying just kind of stuttering symptoms is, I think, the best way to put it, or symptoms that are ultimately leading to you not to be able to do your normal exertion. So
Right.
you can do less exertion before the symptoms present themselves, and you have to slow down and back off, and that's recurrent. That's a blocked artery until proven otherwise. Correct. There's something else that we don't see as often, something called an aortic dissection. The aorta is the big pipe that comes off the heart that feeds blood to the rest of your body. It's a big artery. And when someone has a dissection of that artery, that's a tear or a rip, and people feel it that way. It's sudden onset. It's super scary feeling from the way people describe it. It is a feeling like, whoa, something really bad is happening to me. Oftentimes described as a tearing, a sharp pain, oftentimes more in the back than the chest, but sometimes both. And this is the type of symptom that needs to be figured out very quickly because there are procedures and interventions that can be done, but they need to be done quickly. So, tearing, ripping, pain that's in the chest or back, that's an emergency. Yes.
911 to the
Yes.
emergency room. Right.
If you are someone with very high blood pressure that's out of control, if you're someone with what's called a bicuspid aortic valve, or if you're someone that's a smoker, you should be aware that you're at increased risk of having this type of medical emergency.
Yep. Now we're going to move out of the strictly cardiovascular reasons that you can have life-threatening chest discomfort. The next one is called a pulmonary embolus or PE. This is commonly known as you've got a blood clot in your lung. Usually starts from a blood clot in the leg that travels up into the lungs. And what people really describe is chest discomfort, but they also have really severe shortness of breath
Yeah.
where they become very short of breath. And then they can get this sharp chest discomfort that's worse when they're taking deep breaths in, what we call pleuritic chest pain. And so some of the risk factors for pulmonary embolism are having a malignancy, having recent surgery, having immobility for whatever reason, a really long car ride, a long airplane ride, just
Right.
being immobilized from an illness. All of these things can sort of predispose you to having blood clots form in your legs. Right. And if it's big enough, it can be life-threatening for sure. Finally, the last one that you're not going to see a cardiologist for this because it's a lung problem, but it's something called a tension pneumothorax. So when we talk about somebody's lung collapsed, and it can be spontaneous, it can be in smokers, it can be in younger patients where for some reason their lung collapses and that makes them feel very severely short of breath. And that needs to be seen right away.
Yeah, and that can cause some pain too, and commonly seen after maybe a sporting event where there's some trauma in the chest or a motor vehicle accident. Those are other scenarios where a younger person may be having severe chest pain where the lung collapses, and that's an emergency as well. Okay, Dr. Lacey, let's move into the way more common causes of chest pain, thankfully. These are less
Thankfully.
dangerous causes, but annoying and potentially a big problem for some people. And I kind of break it down in a couple of different sections. One I would say is GI related, gastrointestinal related chest pain, whether it be an ulcer or reflux or acid or a hiatal hernia or esophageal spasm. We'll talk about that. Sometimes it can be an infection like a pneumonia. It could be inflammation like a virus and inflammation of the sac around the heart, which we call pericarditis. Sometimes it's just a muscle ache, costochondritis, or muscular strain. So those are by far and away more common reasons, thankfully, for chest pain. So let's start with some of the GI causes. Why don't you talk about that?
So acid reflux, where they get this acid that goes up into their chest, into their esophagus, a lot of burning. There's oftentimes a lot of metallic taste in the back of their mouth. You might see it after having a spicy meal or when you're laying down, when you first lay down at night, you can get this acid reflux. And it can be pretty severe. It
Yeah,
can be
so
frightening.
associated with meals, associated with laying down, I think those are common ones. The good news is we talked about exacerbating factors or triggers and relieving factors. This is the kind of thing where if you take some antacids and it gets better, that tells us what the diagnosis is because heart pain is not going away with an antacid. So that's a good way to check it
No.
out as well.
Esophageal spasm is very, very close to acid reflux because the esophagus has muscle tissue in the layers of it. And so that can start to spasm and squeeze, and it can give you also pressure and tightening inside of it. And it has the same risk factors as acid reflux does.
Yeah, Carolyn, I'll say esophageal spasms, those symptoms can feel exactly like a heart attack. That is the one other place where I see people saying there's a pressure or tightness in the chest. So it's a little bit scary. And sometimes that pressure is relieved with the nitroglycerin because, as you mentioned, that is just a muscle.
Hmm.
That's something that needs to be checked out, but can mimic a heart attack and be a little bit concerning for sure.
And then peptic ulcer disease. This is just having an ulcer either in their esophagus or their stomach or the first part of their small intestine. And so that area, because it's all sort of right underneath your heart,
Yeah.
it's sort of like, here, I'm going to stand up. You ready? It's sort of
Yeah.
like in the lower part
Yeah.
here,
Yeah.
you can't
Hard
necessarily
to tell.
tell. And it's
There's a lot
okay.
going on here.
There's a lot going on in there.
I remember back in medical school, we'd get the lecture, the 100 causes of chest pain. So we won't go through all 100
No, we're
today,
not
but
going to go
there's a
through all
lot
of
of
that.
stuff going
Yeah.
on here that people worry about. So those are the gastrointestinal causes. How about plain old anxiety? Some people just
Yeah.
feel stuff in here, right? And that can be very scary. You can feel chest pain, pressure. It can be situational, but it can just be while you're sitting around. There can be feeling of fluttering or some nervousness in the chest. It's very hard to tell. That one's hard to figure out for patients, but for us, with an EKG and some lab work and the correct history, we can sort that out pretty easily.
Right. Musculoskeletal. There's a lot of muscles and bones that are keeping
Yeah.
that are in your
These
chest.
the
No
rib
question
cage
about
and
it.
all the muscles and tendons and you have to breathe and everything's moving. So that is a
Everything's moving.
very common cause of chest pain. It's hard to pick
Yes.
up sometimes. When I think of musculoskeletal pain, oftentimes people are pointing to their chest with one finger, like, oh, it
Yeah.
hurts here.
Yeah.
They can point to it. It's worse if you take a deep breath. It's very positional. So
You
that
can
sometimes certain positions cause it, certain positions make it better. So
If
those are the kind of
somebody's
things.
examining you, they can make the same is that the pain
Yeah,
when
we
your
call that
doctor starts pushing
reproducible
on it?
pain.
Yeah,
That's usually a good sign. If you
that's a
can
good sign.
reproduce it, it's not coming from your heart. Yeah,
Right.
that's good. There is something called pericarditis. There's
Mhm.
a sac around the heart called the pericardium. And if that sac around the heart gets inflamed or infected, that can cause some chest pain as well.
Yeah.
And what's unique about that chest pain is people say it's worse if they're laying down flat, but is better and relieved if they lean forward a little bit because the sac of the heart is no longer kind of resting on your spine and things, and it's a little more free to relax in there. So that's a common cause of chest pain that's not life threatening, but can be very annoying and disabling.
We actually see patients in the hospital pretty commonly who do have pericarditis. It
Yeah, and
happens.
it's very common after a heart attack because your heart gets inflamed. It's also very common after a lot of the heart procedures that we do on people, including ablations, pacemakers, stents and balloons and valve issues and other things. That sac
And it
just tends to want to get inflamed. Very
and it
annoying.
can just happen from a viral illness, lots of viral illnesses.
Exactly.
So and
True.
it can be severe enough that people are concerned, end up in the emergency room. Appropriate place.
Yep. Absolutely. All the
Yep.
time. Yep.
That's the appro right.
People tell me all the time, I just want to reiterate here the ER is a good place for you.
Yeah.
So I talk to so many, especially men, who don't want to go to the ER because what if it's not my heart? I don't want to waste my time. I don't want to
Yeah.
waste their time. I'll be embarrassed if it turns out to be nothing. That's what they're there for. It's a
Right.
great place to be for a chest pain evaluation. And I also look at it this way if someone goes to the ER, they're having chest pain, but not sure what's going on, and it turns out not to be heart, great. But it's also a great time for you to start thinking about what you can do to be proactive about your heart health so you don't have the same problem again down the road and what you can do to keep your heart healthy. So I think there's a lot of ways to think about it in a positive way, but go to the ER.
I
They
agree.
would love to see you there.
It's not for
Right.
you to try to figure it out.
It's our job.
We have tests
Yep.
to do that. We have
Right.
places that are appropriate to do that. Yep. All chest pain is a symptom that we need to try to sort out, and it's going to take some time and some tests and answering some questions. The good thing is that most chest pain is not a heart attack and
Yeah.
not coming from your heart.
Yeah. Well
Yeah.
said.
Yeah.
Just get it checked out, though.
Just get it checked out. We hope we gave you some good information today.
Yeah.
We hope you learned something. We hope we gave
Right.
you some reassurance. Please subscribe. let us know what you want to hear about. Ask us your questions. Take care.
Thanks for listening.